Shadeen, can they still submit questions? Here we go. Welcome to Ask the Expert Live, presented to you by the Lupus Foundation of Jamaica. Welcome, welcome, welcome. So this is still your moment to get your questions answered. There's still time to get your questions answered. There's still time to call out your friends, call out your family, call out your neighbors, call out your co-workers, because this is a great opportunity to learn more about lupus. So I'm Dr. McGee, and it is my pleasure to host this program again for Lupus Awareness Month. It is truly a pleasure. So it's still time to get your questions sent in and to call out others who need to benefit from this great session. And so it's Lupus Awareness Month, and it's that time of the year when the lupus community takes the time to raise awareness through education of our families, our co-workers, our extended community, the public at large about lupus, a very complex autoimmune disease that, education is key. And throughout this month, the activities are geared at not just education, but just to make lupus more of an international health priority. And we have a very distinguished guest with us this evening who I'll introduce to you in a few minutes. But here's the opportunity to call others to join us. We are live streaming on YouTube and Facebook, and you can still submit your questions in the chat on YouTube. So without further ado, we're going to go right into our session, and it is my great pleasure to introduce to you our guest speaker for this session. She is truly phenomenal in all that she has done. And if there's ever an expert to take any of your questions, it is Dr. Susan Manzi. Dr. Susan Manzi is here with us. She's currently the Professor of Medicine, Chair of the Medicine Institute, and she's a Director of the Lupus Center of Excellence at Allegheny Health Network, AHN, Pittsburgh, Pennsylvania. She has recently taken on a new role as Chief Clinical Strategy Lead for AHN Living Health. Dr. Manzi received her MD from the University of Pittsburgh School of Medicine. She completed her medical internship and residency at Duke University Medical Center, after which she completed her fellowship in rheumatology at UPMC and received her Master's of Public Health from the University of Pittsburgh Graduate School of Public Health. Dr. Manzi is recognized internationally for her research in premature cardiovascular disease in lupus and in the discovery of biomarkers for autoimmune disease diagnosis, monitoring, and stratification. She has published well over 200 scientific reports and book chapters, and is an inventor of a cell-bound complement activation products technology platform. Lots of science there for the non-scientific people, but this is very important technology to increase the accuracy of our diagnostic tests for autoimmune conditions. And as you know, those tests are very critical to helping us to make the diagnosis in these complex diseases. Her research program has received multi-million-dollar support from many organizations, including the NIH and the Department of Defense. Now, she has served on advisory boards such as the FDA, that's the Food and Drug Administration, and she's the outgoing chair of the board of directors of the Lupus Foundation of America. And she is the medical director of the Lupus Foundation of America. She founded the Autoimmunity Institute at AHN, which is unique in the world as it serves as a national referral center, currently seeing patients from 34 states who travel all the way to Pittsburgh from wherever they can come for consultation regarding the diagnosis, management of more than 100 autoimmune conditions. So she is more than capable, more than able, and she's also been an advocate. So not only is it in terms of education, as a clinician, you're getting a scientist and you're getting an advocate to answer your questions this evening. It is our pleasure to have her with us. So we just want to welcome Dr. Suzanne Manzi to Jamaica virtually. We would have loved to have you here in person to experience the warmth of our people, the warmth of our land of wood and water, but this will do for now. Thank you so much for being with us, Dr. Manzi.
Thank you, Dr. McGee. I have to say my only regret is not being there in person. I would love to have been there. I just hear so many beautiful things and I've never been, so I feel close to you already, virtually.
Okay, great. I'm sure in the future we will have you here in person, because Lupus Foundation is always doing, you know, many events, and we have an annual symposium every year as well. So
Nice.
you'll be here one day. So it's great to have you here with us, Dr. Manzi. And our community is very educated between the work of the Lupus Foundation and you know, other activities that take place outside of mainstream Lupus Foundation of Jamaica activities. Our patients get a lot of contact with specialists that ask their questions, and they look forward to it. And so, you know, everyone is really excited, and I'm just buying some time for others to join to benefit from your expertise this evening. So one of the first questions on our list, and it's always a concern, even amongst us clinicians, you know, survival, right? So one of the first questions on our list, Dr. Manzi, is, you know, what is the life expectancy with lupus? What is the life expectancy?
Yeah, that's a great question. I mean, obviously, that's something that everyone asks as soon as they're diagnosed, because, you know, it's concerning. I mean, it is a disease that has no cure. It's chronic, and there's almost a spectrum, as you know, of severity, from mild disease to very, very severe disease. So when we talk about life expectancy, it's not one size fits all to make that distinction, because we really think of lupus as a spectrum of different diseases. And so the first thing I will say is that it has improved significantly over the past decades. And that's due to better diagnosis and better treatments by far. So that's number one. Number two, most people will say that 90% of lupus patients will be alive in 10 to 15 years, which is good. But that's even better for certain classes of lupus where there isn't major internal organ. If you take certain, even if you look at different ethnicities and different racial backgrounds, you'll see different life expectancies. But certainly people that have very bad kidney disease or other major internal organ, their life expectancy may not be quite as good. So it's not one answer for everyone, but I think the most important thing to take away is the treatments continue to get better, people continue to live longer and live more quality life, quite frankly.
And that's very reassuring for our community to hear you say that. And of course, as you know, a population of persons of African descent, we are particularly concerned when we talk about ethnicity. Just have a quick spin-off question from that. Is it genetics or is it socioeconomics? What would you accounts for you know, the major differences that we see in ethnicities with lupus outcomes?
Boy, that is really a good question, and one that I don't think we clearly have the answers to at this point. There's no doubt that genetics plays a role, no question about it, but it's not just genetics. And we know that for a fact, because probably the best example of how it can't just be genes, that environment is important and how you live and the access to care that you have is important, is if you look at identical twins. I mean, I always try to emphasize, if you look at identical twins, if one twin develops lupus, the chances of the other twin that has the identical genetic background of getting lupus is less than 50%, right? So it's less than a flip of a coin. So if it was purely genetic, they should both have lupus, but we know that's not the case. So similarly, when you ask, you know, why are there discrepancies? Why are there differences? There's some of it's genetic, but then it's also environmental, it's access to care. You know, I happen to believe in what we could probably get into this, it's access to the appropriate diet, because of a lot of the stuff that's going on with our understanding of the gut and autoimmune diseases. It's exposures that you can have. Smoking is a huge risk factor. So it depends, it would be my answer. And I think it's multifactorial.
Thank you so much for that. As you mentioned, diet. The next question on our list from one of our lupus warriors is the issue about weight loss and high cholesterol. So the question specifically is it safe for persons with lupus to take alpha lipoic acid to help with weight loss and high cholesterol? I'm glad you're here to answer that because
Yeah, well, it's interesting because most of these questions, I'll be honest with you, the answers are more by consensus and not necessarily by really hard evidence from published data. Because there aren't a lot of, when medications are approved, let's say for lupus, they go through such rigorous testing, like in clinical trials, and they have to have, arms that are only placebo or, standard of care versus that agent. So we get such rich data to make a determination that this agent does or doesn't work in people with lupus. These kinds of questions, it's experiential, it's a few people reporting that they did or didn't have a bad outcome from it, or it's just general consensus. And I think the answers to most of these questions are that there has been nothing substantial to say it is not safe. That's what I would say. Is there a lot of data to say absolutely there's no risk? No, but nothing has been strong evidence that it is not safe. And my feeling is if it's going to help your cholesterol, that's good, because we do know that heart disease is higher in lupus patients, and anything that can help you control weight is going to benefit you as well. So putting that in the risk benefit, I would say it's probably in favor of agents like that.
Is there anything in terms of diet, as you mentioned, diet? We are a people, our land is fertile, and many people grow up with just looking to the land for, health needs. So we eat, we grow. Some of us eat what we grow, and the herbal therapies, herbal remedies, we get asked all the time. And we know that, as you said, there isn't a lot of data, but is there anything that kind of ranks higher on the list of perhaps maybe of more benefit than other things in the realm of diet and lupus and autoimmunity in general?
Yeah, and another really good question. And people always say, does what I eat impact my disease? And my answer to them is, how could it not impact? Because if you think about it, when you have a headache, you take a pill and it makes your headache better, usually. You have lupus, you take pills. So anything you put in your mouth that goes into your system can impact the disease. And what we have learned, and I'll get to the diet in a minute, a lot of research now on the fact that the gut and the healthy bacteria that live in your gut. So there's bacteria that live in all of our intestines right now that are very critical to our digestion and to our nutritious state. If those bacteria become altered in some way, it actually not only may give you stomach upset, but it can actually impact your immune system. And there's been very, very interesting studies. The most recent one is where they basically, what they can do is they look at the gut, what we call like the composition of the bacteria in the gut of people with lupus, and compare them to healthy controls. And they see there are clear differences, that there are certain bacteria in the guts of lupus patients that you may not see as much in people that are healthy and don't have lupus. Other interesting is that sometimes the composition of those bacteria will change during active disease versus periods of quiet or remission. So we even think they may impact your flares in some way. And how many people, and maybe they tell you this, Dr. McGee, but my patients will come in and say, Dr. Manzi, I had to take an antibiotic for X and X and this, and I felt so good for 2 weeks. or something. They'll have some impact of that antibiotic. Well, if you think about it, antibiotics change the gut bacteria because they can influence that. So there's a lot we're learning about the bacteria that are in our guts. So having said that, diet will become really important once we start to unlock the key to how we can control the bacteria that are in our gut. What we know so far is that plant-based diet, so when you say you live off of what you grow, to me, out of the gate, that's healthy, because what isn't healthy are processed foods. And I had a nutritionist that I worked with once, and she said, I tell people foods are healthy if they're real food, as opposed to, these things you can buy processed and packaged in microwave. So plant-based diets, amazingly good. Obviously healthy diets, as we've talked about, things like omega-3 fatty acids, if you've heard of those. Those are the fish oils, very good, right, for heart and vascular health, but also for autoimmunity. So I would say stick to the plant-based, stick to healthy foods, and just be aware that what you eat can impact your lupus. And there are anti-inflammatory diets out there. And by the way, I also have patients who, if they eliminate gluten, they feel better. If they eliminate dairy, they feel better. So they'll do some elimination diets to see what impacts them, and then try to keep that diet as a part of their treatment. And I'm all for that. So I'm a big advocate of that.
Thank you. Thank you for that. That's actually our global message to our patients, some of your points. So thank you. Thank you for reassuring that and backing us up. That's great. All right. I'm going to just shift away from the diet a bit and speak to some specific concerns that our patients have raised in questions that they've sent. So we have a patient who has problems with the scalp being itchy constantly. And she's asking about, what is a better hair product? I feel like you know everything about everything. So yeah, you can have that one too.
Oh, wow. I wish I knew hair products. I will say there are, okay, so let me take a step back. I mean, obviously, there are products out there for sensitive skin, that have the least preservatives, that have that are known for, I'm talking about, if you're talking about shampoos and things that you use, you can find them. And I think there's a lot out there that really do claim to be for sensitivity. But if in fact you have a lupus rash that is impacting your scalp, causing it to be red or irritated, there are products. And one of those is a topical steroid, but it's a foam, right? And so you can get it in the formation of a foam or solution. So it's not like a cream or oil that's going to make your hair sticky. And sometimes there's different names for it, but it could be a topical clobetasol foam that you just put it on and it kind of disappears, right? So it doesn't impact your hair very much, and it can be very effective as well. So there are products out there, and not that there's one that comes to mind that you should use specifically.
Okay, thank you. I hope that's very helpful to our lupus warrior. That's great. We can check that out. Certainly, we can ask our dermatologist about that. Yeah, thank you. Thank you so much. So we're going to talk a little bit about pregnancy, which is actually going to be our theme for our annual symposium.
Right.
One of, so we're looking at reproductive health, males and females. And so we have a question here that is asking about, safety. When is it safe to get pregnant? So this is someone who states that their lupus is mainly affecting their skin. So that's the kind of phenotype kind of picture that we're looking at. And that would happen when they're off medication and not maintaining a gluten-free diet, as you mentioned. So they're asking, if that is their profile, is it safe to get pregnant?
So the first global message I would give to all of the women of childbearing age out there, or men that may have an interest, is that our goal is for women with lupus to have healthy pregnancies, right? We never want to say, no, you shouldn't get pregnant. So the default is absolutely. The question is timing, right? That's the key. And the key to timing is the best is when your disease is the least active or inactive, and your doctors can help you with this. And it has been inactive for a good period of time, right? On stable medication. Now, if that's the case, you don't have bad active kidney disease, you don't have bad active internal lupus issues, then I would say then it's time to start planning pregnancy. And the way we plan pregnancy is that we make sure your disease is quiet, which I just mentioned. We do check certain markers in your blood to see if you would be at risk for two things. One is at risk for pregnancy loss or miscarriage by checking certain markers. We call them antiphospholipid antibodies. There's a set of them that you can check. If you have high levels of those, you may be at risk for a miscarriage with the pregnancy. And there's things that we can do to address that. There's another marker in your blood that may indicate that you have a baby that may have neonatal lupus, which is a transient, it's just transient because for the first 6 months of a baby's life, they have the mother's immune system. They're building their own. And so you passively transfer your antibodies and immune system to your baby for the first 6 months. And sometimes they can develop a little facial rash that looks like lupus, or their platelet counts or blood counts can be off. But most seriously, and the thing we worry about most, is they can develop fetal heart block. So their heart can actually have problems with the heart rhythm. So we need to know if you carry those markers, because then we have to monitor your pregnancy a little differently. However, having said that, the final thing that we do, and that doesn't mean you can't be pregnant, it means we monitor you differently during the pregnancy. And then finally, we have to look at your medicine. There are certain medications that you should not get pregnant on because they can be damaging to the growing fetus. They're teratogenic, we call them. So you have to talk to your doctor. The best thing to do is to plan, right? Unplanned pregnancies are what make us nervous. So you go in and you say, is it okay for me to get pregnant? Your disease is inactive. We've checked these markers. You're on the right medications. It's okay to try. That's what we like to do, because there are medicines we can switch you from one medicine to the other that's safe during pregnancy. So it's all about planning. That's the key.
Thank you, Dr. Manzi. So we married the P. We say pregnancy planned. PP.
Exactly. I'm right with you.
Yeah, so thank you so much. So I'm sure that's very helpful to our lupus warrior. And I'm going to continue along the lines of pregnancy. And we have a lupus warrior who's asking if there's any research that has shown that persons with lupus who become pregnant and have children, that this contributes to a reduction in their lifespan.
No. I have not seen anything that would be convincing to support that in any way.
Okay, thank you. I'm sure that's reassuring, along with all of what you just said about pregnancy, very importantly.
We love lupus babies. We love when our women who are have lupus have babies. We have little charts of all the baby pictures in our offices, because it's a wonderful thing. And it used to be years and years ago, doctors would tell lupus patients they couldn't get pregnant. Right. And in some situations recommended hysterectomy, which tugs at my heart, because that is not where we are in 2022.
Absolutely not. Thank you. Thank you so much. And you're one of the world experts in all things autoimmune. And so our next question is about having lupus and a disease entity called mixed connective tissue disease. So our question is mixed connective tissue disease common amongst patients with lupus? And one of our lupus warriors has submitted that question for you to answer for us.
Yes. So, that question, boy, you could get a panel of doctors talking for a long time about that question. So first of all, the question that we're grappling with, and actually the Lupus Foundation of America has a global effort right now that is looking at what are the barriers that are still out there that we have to address keeping the lupus field from moving forward. And believe it or not, one of the biggest barriers is defining lupus, right? What is lupus? We have these criteria that you hear about, but those criteria were not developed to diagnose people with lupus. So herein lies the problem, and one of the reasons why people go undiagnosed. Because lupus can have so many different faces. I usually, in my talks, I start with a Rubik's Cube, the Rubik's Cubes, and basically say many different colors, many different faces, difficult to solve, right? And so I think technically you could argue that depending on what you mean by mixed connective tissue disease, it's all lupus. It may all be lupus, because what you may think of as lupus, there's a lot more that could be included under that umbrella. That's number one. Number two is, so that's possible. So the answer is, I have many patients, and I'm sure Dr. McGee does too. They don't look like a textbook lupus patient. Textbooks are textbooks. People are people. And so people don't fit textbook definitions or whatever we use in textbooks. You have a mix of things. And so it's perfectly normal and perfectly common for you to may have a mix of other different autoimmune diseases. And it's not uncommon for people to have more than one. They can have Hashimoto's with lupus, right? They have Raynaud's. Is that lupus? Is that a separate entity than lupus? Some people can have inflammation of their muscles or something we call myositis with lupus. That all can go together. It's perfectly normal. It's perfectly common to see that. And we can treat those just as easily as we can to treat somebody who is a textbook lupus patient. So don't feel like you're alone. You are not alone. Many, many, many people are with you with that mix.
Thank you for that. We have a concern about a manifestation. We say lupus, a disease of many faces, 1,000 faces. I like your Rubik's Cube thing. That really captures the essence of lupus indeed. And so sometimes there's a tendency to think, okay, everything that happens in lupus is lupus. And sometimes we're not sure. So I think this is a question that speaks to a manifestation. And the question is this part of lupus? So the question is it possible for there to be an association between lupus and having a stricture in my throat? I find swallowing a bit difficult over the past few months. This patient also says she has Raynaud's phenomenon.
Yes, so, it's interesting. When you think of strictures in the esophagus, there's a few things you can think of. So first of all, people that have a lot of reflux, right? Or, they call gastroesophageal reflux, or GERD is what we sometimes refer to it. All of that recurrent irritation can sometimes lead to abnormalities in the esophagus. So you want to make sure you treat all the heartburn and any kind of reflux that you may have. But based on what you're saying, and I'm sure Dr. McGee is thinking the same thing, sometimes lupus can overlap with a condition called scleroderma or systemic sclerosis. Scleroderma is what we used to call it. The new name is systemic sclerosis. That is an entity that can be seen with lupus in one of those overlap situations, or some people call it mixed, but overlap. And that condition is where you see really bad Raynaud's, where the fingers can turn white and purple, and sometimes get ulcers on the tips. Sometimes the skin will get thick or tight in the fingers. And a lot of those patients actually have difficulties with their esophagus because their esophagus doesn't pump the food down. And it's a motility problem, because when you swallow, your esophagus essentially squeezes the food to get down into your stomach. And people can lose that ability, that motility of the esophagus. That happens often in scleroderma, and that can also lead to strictures. So the first thing I would want to ask this person or check, is there a possibility that you have an overlapping condition with something called scleroderma? If not, and there's nothing there, then I would want to make sure your esophagus is moving properly, and they can do motility studies. They can watch you swallow to make sure the food goes down properly. And if all of that is normal and it's just a stricture, you can have it dilated. They can just go in and open that stricture and then treat any kind of reflux that you have. And that could help.
Okay, thank you so much. So definitely, our warning to discuss that with her rheumatologist and to do
Yes.
further investigations for sure. Thank you. Moving on to, well, before we move on a little bit, I'm gonna let you catch your breath a little. This is great, great stuff. I'm sure that everyone is excited to get these questions answered. And just to let you know that if you're watching live and have questions, you can place them in the chat. So some persons have sent questions to WhatsApp. It's better to place them in the chat, and we'll get these questions answered. Actually, I do have a few questions. I have questions coming in that I'm going to go to along with the questions that we received ahead of the program. So Dr. Manzi, I just gave you a couple seconds to catch your breath. Here we go again. All right. Now, lupus, you think about lupus, you think about the blood, you think about abnormalities in the blood. So I'm going to go in that direction a little bit with some of the questions that we have. So someone has written that they have problems with low blood platelets, and it's been as low as 73. So the question is, how low is too low, and how would you treat this condition? And of course, that would be individualized, but so I know you can speak to us in a general manner.
Yeah, I do think you're very right, Dr. McGee, in reminding people that it's hard to give you very, very specific advice without examining you, knowing your history. So please take what I say with a grain of salt, because I don't have all the details. I can just talk about generalities. And so low platelet counts at the level that you just mentioned are not uncommon in lupus patients. We often see them in two situations in people with lupus. One is lupus patients who carry those markers that I mentioned that can make you at risk for having miscarriages. Those are those antiphospholipid antibodies. People that have those antibodies and have a risk for blood clotting, often those people have bad migraine headaches. They could have had blood clots and are on blood thinners. They often will have platelet counts that range in that low but not treatable range, right? So most platelet counts should be over 100,000. That's what we typically say. A lot of people will be in that 50 to 100,000 range, and they may have that they carry those markers. So that's one. The other are people that can go really low, and that's where their immune system is targeting their platelets, kind of chewing them up, and their platelet counts can go to 3,000, right? They should be 100,000. And in those situations, when they get below usually a level we say of about 15,000 or 20,000 is when we have to step in and treat. And that's when we try to quiet the immune system down to not attack the platelets, to allow the platelets then to kind of get back to a normal level. So we let platelets go fairly low as long as there's no bleeding issues. If your gums are bleeding or you're having bleeding from your nose, that's a different story. So 70-some thousand in general is perfectly safe as long as they stay there.
Thank you. And just to clarify for our lupus warriors, actually, so Thelma, 73, it's the same as 73,000. They're just different units that we're using. So when Dr. Manzi says 1,000, we just, so 73. So when she says 100,000, your platelet would be 73,000, just to clarify that.
Oh, I didn't know that. Oh, okay.
So
Okay.
just a unit change. So we just
Thank
fixed
you. Okay,
yeah.
thank you for
Because
that.
she's probably going, 100,000, now it's 73. So her 73,000. Yes.
Yes.
We should have stated
That's okay. Thanks for clarifying.
Yes. Thank you for that. And it's just a segue on low counts. We often see low white cell counts, and early on in my career, I'd kind of freak out about some white cell counts, dipping below normal, but I've gotten comfortable with that. But for patients, it may not necessarily be so comforting. Perhaps you can just touch on that a little bit, white cell counts.
Boy, that is so true. Early in my career too, I would get very nervous when I saw white blood cell counts that are low. Now, I have people that have very low white blood cell counts and they are perfectly fine and we're not doing anything about it. The key is, are you having increased risk of infections, right? Is there a consequence of those low white blood cell counts? If there's not, and there's certain cells we can look at. One are neutrophils, sometimes it's lymphocytes. We can look at both. Then we basically don't worry because it is a part of lupus. And sometimes your medications can make it a little worse as well, can kind of drop that white blood cell count lower. So don't panic about it. I agree with Dr. McGee. We're very tolerant of lower levels as long as you're doing okay.
Thank you very much. Hydroxychloroquine, that is our water.
Yes.
Must have hydroxychloroquine. That's a song and dance. Hydroxychloroquine, hydroxychloroquine, hydroxychloroquine. Is that your song and dance
Yes,
too?
it's my song and dance too.
Okay, Dr. Manzi. So we have a question about hydroxychloroquine. So this is a patient who has discoid lupus erythematosus. And I take it to mean that she only has discoid lupus, and that's a skin disease, which you can tell us about. And so only discoid lupus, and she's asking, should she be on hydroxychloroquine?
Well, my feeling is that anyone with a diagnosis of lupus should probably be on hydroxychloroquine, with some exceptions. Don't get me wrong. There are maybe situations where someone has no symptoms, perfectly well, no skin rashes, no disease, and may or may not need hydroxychloroquine. However, someone with discoid lupus, in my estimation, even more important to have hydroxychloroquine because there's a few reasons for it. One is it does help against some of the sun effects that can make discoid lupus worse, which again, sun protection is really, really important. It can help with just preventing worsening of the discoid rash. And believe it or not, and I tell people this, hydroxychloroquine is the only agent we really have that has been shown to prevent progression of disease in lupus. Hard to believe, right? Because we think of it as relatively mild, but it tends to being able to prevent progression of major organ system disease, even if you don't have it at the diagnosis point. So I like that. It prevents organ damage. It's been shown to improve cholesterol levels. It's been shown to improve your heart health and your blood clotting issues. I mean, there's so many things. It even has been shown in rheumatoid arthritis to help prevent onset of diabetes because it can lower blood sugar levels. So to me, hydroxychloroquine is a mild, easy to take, very few side effects medication that has a lot of benefit.
Awesome. Thank you for that. We are going to take a little break, Dr. Manzi. I'm going to take a little break, let you catch your breath, and
Okay.
we're going to just throw over to our team in the back to just give us some highlights. This is Lupus Awareness Month, where we are definitely shedding the spotlight on lupus for the purposes of education and for the benefit of all those living with lupus and affected by lupus. And this is a global endeavor. So we're just going to throw it to a break now. Stay with us. Do continue to put your questions in the chat, and the theme is to level up, and we want you to join the fight. Level up. So we want lupus to be elevated to that level of importance as many other diseases that people think are, very important. We want it to be up there. So level up, join the fight. And you being here means that you've joined the fight. So thank you so much. So we take a little break. Okay, I want to thank you so much for staying with us. And if you just joined, or if you joined after we started, this is Ask the Expert Live, and we have world expert Dr. Suzanne Manzi with us, taking questions that were sent in before, and she'll answer some of your questions in the chat as well. And we just want to remind you that this is Lupus Awareness Month, and we're leveling up. We're getting lupus to get that attention that it needs as a very important disease to be recognized and understood and treated effectively. And so we're happy that you have joined the fight. By being here, you're joining that fight. And then you can also continue to be a part of the Lupus Awareness Month activities. So wherever you are now, you can like and subscribe to, if you're on YouTube, if you're on Facebook, and you can check out the Lupus Foundation of Jamaica's website, and you will see upcoming events. So a couple of just quick things that you can know, to increase the awareness and visibility of lupus. You see, purple is our color. So on Fridays, we have put on Purple Fridays. So you wear purple on Fridays in solidarity with persons with lupus. When you see the purple, when someone sees the purple, they'll probably ask you, and that's a nice, conversation starter, so you can educate someone about lupus. And if you know, or you want to share your story, if you know an inspirational lupus warrior, or you want to share your story with the world, you have the opportunity to do so during this month. And you can just make contact with the Lupus Foundation of Jamaica, and we will get your story out there. It's always important to let others know that they're not alone. Your story can make the difference in someone else's viewpoint on living with lupus. So go to www.lupusfoundationjamaica.org. And we have upcoming our lupus symposium. So we know we have medical practitioners, I'm sure, online. That educational symposium is coming up, and it's on October 23, so 23rd of October. CMEs and lots to learn, and our focus is on reproductive health and everything to do with that for males and females. It's free to patients and the public, and definitely a great opportunity to hear from more local and international experts. And we just want to say thank you to our sponsors for Lupus Awareness Month. As you know, the Lupus Foundation of Jamaica is a member-based, volunteer-run organization, and so it's dependent on membership, and it's dependent on the benevolence of those who contribute to the organization. Lots of what is done, and programs, many different programs and many opportunities for education. You can just simply go on the website, and you will see that's our first point of contact, not to mention the number of outreach events and programs throughout the year. All of that is paid for by dues and by fundraising. So it's very important that we acknowledge our sponsors. And certainly for 2022 Lupus Awareness Month, there's a Jamaica National Group, there is Jamaican Teas, Real Zim Studios, the Imaji Nation, I hope I have that right, IMAJI, hope I get that right, and Axel Business Solutions. And at the Lupus Symposium, we have our gold sponsors and National Health Fund always on board with the Lupus Foundation of Jamaica. Always very important to the work that is done with Cinco and IPCA Laboratories and Co-Create Limited. So without your assistance, Lupus Awareness Month 2022 will not be the success that it is going to be, and that it has already started to manifest itself to be. So we do want to highlight you and to thank you for that. So remember, we're also on Instagram and LinkedIn. All right, so you can help with our social media campaign by using your own social media pages and platforms to promote the events for Lupus Awareness Month, and just sharing the stories of those living with lupus who will be highlighted this month, and your own story, whether you are living with lupus or a supporter of those living with lupus. So we're going to go back to our questions. We have Dr. Suzanne Manzi with us, and she is a major super clinician, scientist, and advocate. It's really great to have someone like you take our questions. We really do appreciate you taking your time, and we really want to thank you again for that. All right, so we're going to just throw a photo up. We're going to throw a photo up. We got a photo sent in, and a picture is worth 1,000 words. So I'm going to have the photo come up if while the photo comes up. So someone wants to know: is this a lupus mark? Is this a lupus mark, Dr. Manzi? Is this lupus?
So my answer is it could be. So the way I would describe that is a what we would say hypopigmented, meaning loss of pigment, lesion or rash on the face. There are forms of lupus that can do this because what causes that loss of pigment, particularly in darker skinned people, is generally inflammation. That can then result in loss of the melanin, which is the pigment in the skin. So that could be a form of discoid lupus. However, it's not necessarily discoid lupus. There are other conditions. One is called vitiligo, where vitiligo is essentially a skin disorder where you just lose pigment in certain areas and you do not have lupus. It's autoimmune also. So this would have to be evaluated by a dermatologist to try to help with that distinction.
Thank you for that. And as you mentioned, discoid lupus, that takes me to our next question. Patient says, I have discoid lupus. I get bumps that itch very badly, and she rubs them gently and applies betnosol cream, but there are spots that persist that won't go away. And so the question is, lots of the times when patients have active skin disease, they do end up with dark spots, dark marks. We call it hyperpigmentation. And we often get asked, what can we do about that? She goes on to elaborate that she has a plant-based diet, and that when she includes eggs and chicken, she breaks out, kind of speaking to the diet that you mentioned before. So she's sharing with us how her skin is affected. She's on methotrexate, hydroxychloroquine. She also has joint pains, but her main concern is the skin and the consequences of lupus rashes.
Yeah, lupus, people always have sometimes inaccurately said, oh, it's only skin lupus, right? It's not the other internal organs. And I don't like that because you know how debilitating and how impacting on quality of life bad skin disease can be. So skin is just as problematic and serious in lupus patients. So I understand how you're struggling. First of all, I would say you are on medication and those medications can help, but there's other medications out there as well. So you haven't exhausted everything that might help your skin disease. So the key is, are these itchy bumps related to lupus or are they something else? Because it sounds like you have a lot of allergies also. So you would want your doctor to distinguish the itchy bumps from what is truly your discoid lupus. That's number one. And I will just tell you one story on one medication that we have called belimumab. I had a patient with terrible discoid lupus, dark skin, but had terrible hypopigmentation. And after, being on belimumab for a few years, she just repigmented much of that lost pigment. So you can get repigmentation of some of those areas with appropriate treatment. Not always, but sometimes.
Mm-hmm. Thank you, Samantha. Thank you for that. We would have to talk a little bit more about having belimumab because you don't
have it available.
Have access. But certainly it's good to know the spectrum, because one of the areas that Lupus Foundation is very very active about is advocacy for getting the necessary treatments available, not just available but also accessible by subsidized subsidized costing. So definitely
I hope you can, because even anifrolumab, which is another newly approved, really good for skin. So, whatever I can do to help you advocate, please let me know, because you should have access for sure.
Thank you so much for that. I'm sure Dr. Tolleri this.
I would be happy to. You could be happy to.
Yes, we do need more And so just to let our patients know that all our drugs for lupus are subsidized by the National Health Fund. And so we're talking about, a drug that isn't available as yet, but everything that you do need that is available currently is subsidized by the National Health Fund. And a lot of that has come because of the work of the Lupus Foundation of
I
Jamaica.
believe that. I
So,
believe that. And you
and
do have
most
mycophenolate
yeah,
mofetil, right? Which can be very effective for skin too.
yes,
So,
yes. And most are available in the government system for free as well.
wow.
Yeah.
So that's wonderful.
Okay,
That's
Dr.
wonderful.
Manzi, we have more work for you. We're going
Yes.
to hit up the chat now and get some questions from our viewers who have been sending in questions live. I'm sure you've seen some of them. So I kind of scrolled up to the top for the earlier questions. And I think this is a great question to segue to because we're talking about treatment. And I think you pretty much touched on this. So you pretty much said it in terms of talking about the approach with hydroxychloroquine, but just so you could just give us a quick summary to help Enola. She's asking, what are the best treatment options today?
Yeah, I mean, I think they're pretty broad. It depends on there's not one right treatment for every patient, right? It depends on the patient, it depends on you, it depends on the problem that you're having related to your lupus. But some of do you have the anti-inflammatory, non-steroidal anti-inflammatory agents available?
Yes.
Okay. So, those can be helpful sometimes for joint issues or muscle aching. You have corticosteroids, the prednisone or the Medrol, not great long-term, but can be very effective to help with things that are lots of different manifestations to get things under control. Plaquenil, hydroxychloroquine, great for skin, joint, fatigue, mouth ulcers, and again, prevention of progression of disease. Methotrexate, excellent. Skin, joint, for sure. Mycophenolate, mofetil or Celsep, very good for kidney disease, but also skin as well. So, and then it appears that you don't have access right now, at least to some of the biologics that are out there. And there's also things like, do you have tacrolimus available or any
Yes, we
calcineurin
do.
inhibitors? So the calcineurin inhibitors can be quite helpful as well. What about voclosporin, the new one?
So not yet.
Okay, not yet. All right, that's okay.
Some amount of azathioprine, and
Azathioprine.
we need some help. We also have rituximab.
Oh, perfect, perfect. Yeah, rituximab can be very helpful, particularly for the blood counts when those platelets go really low, or the blood counts can be good for skin, can be good for other issues. And azathioprine, the thing I like about azathioprine is it's good with pregnancy.
Yes.
So we will switch people to azathioprine when they are anticipating a pregnancy.
Absolutely. So we're not doing pretty badly, I would say. But you'll help us get
Yeah.
the big ones, the big guys, the new
Got
guys.
the good ones. You got the big ones.
All right. Blood clots. So blood clots and lupus. There's a question about blood clots and let me get you the specific.
It says something about, are they serious?
Yes,
Okay.
it's dangerous for lupus patients to have blood clots. Blood clots are dangerous in general, but I think, you can speak to us about lupus and blood clots.
Yeah, I mean, in general, you don't want a blood clot, and they can be very dangerous depending on where they are. If they're in your lung, if they're in the brain, they can be harmful. But for the most part, they can be treated. They can be treated with blood thinners, and people can do quite well with that. The issue with lupus is that if you have certain markers, you may be at higher risk for recurrent blood clots, so that you may get them more frequently. So that may mean you need to be on longer term blood thinning or anticoagulation, as opposed to someone who may have just gotten a blood clot without lupus. So we have to look at you a little differently when you have lupus.
Right. Okay, let's talk a little bit more about kidneys. We're talking about some drugs that specifically target the kidneys. So there's a question, is protein in the urine a serious issue for lupus patients? And how can you control this issue naturally? So, there's a great interest in natural, remedies. And so I'll give you that one.
Yeah, well, first of all, I'm a big believer in natural remedies too. So, I am a big advocate of any kind of alternative to drug interventions, if you can do them, right? If there are dietary changes that can help you, I'm all for it. If acupuncture works better than a pill, I mean, anything that can minimize the amount of medicine you take, I'm all for it. But it comes down to sometimes you need the medicine. And so it's a good way to complement some of the medical treatment that you need. So is protein serious? It can be. It can be serious if it is a marker of active kidney disease from lupus, which means that your kidneys are inflamed, they get leaky when they're inflamed, and they let protein leak into the urine. So it can be a window to what's going on in the kidney, which is why when we see protein in the urine, we get our antenna go up and we say, hey, we better make sure everything is okay with the kidneys. So we may try to estimate how much protein is in the urine and determine whether or not you may need a kidney biopsy to make sure we catch early lupus in the kidney so we can treat it. And you've got all the right meds to treat it here available. If it's a small amount of protein and it comes and goes, it may be absolutely not concerning. It could be related to some people that are very active and run a lot, or marathon runners or exercise. Sometimes they'll spill a little protein in their urine as well. So it's really a matter of how much, how consistent it is, and if there's any other indication of active lupus.
Okay, thank you so much. I am going to go to a question about, where is it? It just slipped me. So I'm very happy to know that you have a particular interest and, of course, expertise in cardiovascular disease. And we know that up there with infection are, the things that we really worry about with our patient survival, right? So just to go to the heart a little bit, and someone is asking, could heart palpitations be a manifestation of lupus, or is it something else? So,
Yeah, so heart palpitations, that's one of those things that most of the time, I'm going to say most of the time, are very benign and not concerning. And let me explain that. I'm sure if we had you all in a room and I said, how many of you every once in a while feel your heart go boop, 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 or you feel it kind of beating a little funny just for a few beats? That's very common. And sometimes with age, women will notice that even more. Generally not concerning, right? If you are someone that can get periods of very rapid, really, really fast, where you feel it's pounding out of your chest that lasts, or really irregular beats that last for a period of time, and most of the time, or if you have chest pain with it, or you're short of breath, or you feel like you're going to pass out, that can be more serious. And in those situations, by all means, tell your doctor, because they can put a monitor on you, they can do an EKG, they can figure out whether or not it's serious or not. But don't worry if you feel a few blips, because those generally are not concerning. Can rapid heart rates or abnormal heart rates be a part of lupus? Yes, they can. Usually it is in people that have something we call dysautonomia. It's a big term, but it is where there is a nervous system, there are nerves that actually control the heart and control the actions of the heart. If those become disturbed, what will happen sometimes is that when people stand up, normally their heart will just start rapidly beating and they get very lightheaded, because the nerves that are supposed to keep things regulated aren't working the right way. That's called dysautonomia. Some people call it POTS. You may have heard of that. And sometimes that can be from lupus, and it can cause irregular heart rates and people feeling like they're going to pass out when they stand up, and problems with their blood pressure dropping quickly when they stand or change position. So that would be one way in which it could be impacted by lupus.
Thank you. and since your area of expertise, one of your areas or one of your interest areas is cardiovascular disease, I'm going to just have you talk to us a little bit about cardiovascular disease, because often we think about the things that we can see. We can see the skin, we can see the joints, we can see the hair, but for patients, it may not be readily in their mind that cardiovascular disease, so heart disease, is a major problem for patients with lupus. So I'll just give you a few, I'll just let you give us your key messages on that.
So my key messages, number one, are that since 90% of lupus patients are women, 90%, we tend to not think, and they're young, right? Between the ages of 15 and 45 often, when lupus starts, we often do not think heart disease. Women, young, heart disease isn't an issue. That is not the case with lupus. Very much like diabetes, where we are very tuned in to early heart disease, we should be the same with lupus patients, because their risk of heart attack, their risk of stroke is about 2 to 3 times higher than someone of similar age that doesn't have lupus. It's even equal or higher in certain situations, certain things, with people with diabetes. So what does that mean? That means you should be thinking about heart health, healthy diet, low cholesterol, no smoking. Make sure your blood pressure is under control. Make sure you get regular exercise and check those cholesterol levels and make sure you're treating what you can. So be tuned into your heart, even if you're a young woman, because premature heart disease can develop.
Thank you. Very important and straight to the point. I love that. I have a question, which is deviated a little bit from our patient questions. We have a question from our one of our rheumatology community, and it's a very important question, Dr. Manzi. How can we as medical practitioners engage our patients to be more empowered to take charge of their health in low-resourced settings?
Oh boy, if you can solve that in Jamaica, can you let me know? I will say what you're doing right now is the first step, for sure. I mean, it's all about, you're absolutely right. To me, an informed patient will have the best outcomes, right? If you understand lupus as a patient, as somebody suffering from lupus, learn as much as you possibly can about the disease. Ask questions. And I always say, if you have a doctor that doesn't want to answer your questions, you should find another doctor, right? So ask questions, be empowered, take control, learn what you can do, your diet, your stress levels, meditation. I'm a big fan of the yoga, anything you can do to kind of control what you can control, and then get with a physician that you trust to take care and help you with the rest. You're going to have the best outcomes. That's my opinion, and I've seen it for the past 25 years. So people that, it's hard when you're trying to reach people that just don't have the same means, not the same education level, they just don't have the same capability. And in those situations, the way we try to address it is by getting into their communities and working with community health workers, which we call, we bring in community health workers that live in certain communities that are underserved, and we use them as a conduit to get in, to be able to have a voice, because they'll listen to peers more sometimes than they will their physicians. So you need those ins in those communities sometimes.
That's great. That's actually a great tip for us, because we do have community health aides within the framework of our healthcare system.
Yes.
So that's actually pretty good. Good to hear. And on the note of empowering our patients, one of our challenges, and I always ask every expert I can find, is, have you found out the best strategy to improve compliance? So just to have our patients take their medications all the time, the way they should take it.
Yeah, that is such a good question. And, I'll tell you how we did it, but I feel like we may have a little bit of a luxury, because I fought hard for this. But in our lupus center, I brought in a pharmacist, and our pharmacist, she's a PharmD, they call them a PharmD. So really smart, very educated in autoimmune diseases, autoimmune medications. And what I have found is that when she steps in to just make sure they understand, because you know how quickly you have to see patients. Maybe you're in the same, you have so much time, you focus on so much. You ask somebody, are they taking a medication? They say yes, and you move on, right? And we don't always have the luxury of checking levels, drug levels, because drug levels can help, which hydroxychloroquine, we will do that. We'll check levels of that, and methotrexate sometimes. But what I have found is they'll tell me they're taking something, but if I have my pharmacist go in and talk to them, or talk to them, reach out to them afterwards, they're very honest with her, because they will be honest that they don't understand. They get a bellyache when they take their medicine, but they didn't want to tell me, about it. So our pharmacist has uncovered a lot of non-compliance where patients didn't want to disappoint me by telling me they weren't taking it, and it is a problem, because we tend to think things aren't working when in fact people aren't taking the medicine. So I also have found myself asking the question a different way. This is just a little tip. So if your patient's out there and your doctor asks this is they're trying to figure out, because it's true. I mean, look, I forget to take my vitamins in the morning, right? And I forget. So it's normal to forget. So I will often start by saying, somebody on hydroxychloroquine, it's really hard to remember taking medicine every day, and you're busy and you're working. I bet you miss some days. And if you ask it like that, like it's okay to answer it, they'll say, yeah, Dr. Manzi, I do miss. And I'll be like, well, how many times do you think you miss in a week? And they may say, well, I really haven't taken it for the past 3 weeks. They'll become more honest if you acknowledge how hard it is sometimes to remember. So, sometimes it's what what's the term for it? It's, kind of the way you ask questions can be a little bit more enlightening.
Yes, thank you for that. All right. We're winding down. We really want to reach everyone with their questions. So Dr. Manzi, an elevated CPK, creatinine phosphokinase, creatinine kinase, CPK. What does that mean? One of our viewers on Facebook is asking.
So first of all, it depends on the level of elevation. A mildly elevated CPK can be completely normal in certain populations. We see it all the time. If you don't have muscle weakness and it's just mildly elevated, it usually doesn't mean anything. If it's highly elevated and you've got associated weakness in your muscles, it may mean that you have inflammation in the muscles, and that's when you may need further testing and maybe a little biopsy of the muscle to see if there's inflammation that has to be treated.
Okay, thank you very much. And we have a question about cataracts and medication. So can cataracts be associated with medications for patients with lupus?
Yes, corticosteroids. Steroids are notorious for causing accelerated cataracts, which is why we like to minimize the use of those medications, the corticosteroid medications.
Okay, so we'll do some rapid fire while we close up. What supplements can you recommend for lupus patients? That question is coming from Facebook, from one of our Facebook viewers. And earlier we spoke about the value of, omega-3, fish oils, and so on. But often we get asked about other things, should I be taking extra B vitamins? Should I be taking extra C? Should I be taking extra vitamin D? And so I'll leave it to you to go.
Yeah, I'm a fan of anything that if you have a vitamin D deficiency, vitamin D, for sure. It helps your bone health. I'm a fan of vitamin D. If you have low B12 levels, and you can have those checked, B12 supplementation can help significantly. So it depends. I am a fan of, as I mentioned, the omega-3. I think they're very helpful. There's a lot of interest in turmeric now in the US. No problem with that. To me, if you think about it, it's just replacing what's deficient and living a healthy and having a healthy diet is really the most important. What I'm not a big fan of is taking all these supplements that you don't know what's in them, because number one, they're expensive, and number two, they're not regulated often, and there can be things in there you don't know about that may be more harmful.
Okay, definitely. Okay, Dr. Manzi, lupus and strokes without hypertension and diabetes. So no hypertension, no diabetes, no cholesterol, but strokes in lupus.
Yep, not uncommon. Again, the higher risk, 2 to 3-fold higher, and often associated with those markers, those antiphospholipid markers that increase the risk for clotting and miscarriage. So unfortunately, we see it, but it can be treated.
Okay, winding down, what is the ESR? And so erythrocyte sedimentation rate, that's the ESR, and how much should it be?
Yeah, so an ESR is a very, very, it's a way that we measure levels of inflammation, pretty much. And it's hard to say what level, because depending on your age, depending on other things, what's normal for you may vary from the person next to you. But your doctor that knows you and knows what your previous levels are can interpret it in a much better way.
Okay, Dr. Manzi, you know, lupus, we talk about triggers, and everyone knows about, staying out of the sun, wearing your sunscreen, and so on, avoiding ultraviolet, light sources. So diet, are there any foods that in your, decades of experience that patients with lupus should avoid?
Again, I think it depends on the per patient. I'm going to be honest with you. There are patients that will swear by the fact if they have dairy, they'll have a flare, or swear by the fact if they eat gluten, they have a flare. So I actually think that it's up to you to figure out, are there associations with certain foods? That's number one. We know that smoking can increase risk. As a matter of fact, a really nice study showed if you took two populations of patients that have high risk gene profile, so they have a high risk based on their genetic background, and you take smokers and you take non-smokers, the risk of developing lupus is exponentially higher in the smokers. So those kinds of, and to me, they're just not healthy habits, right? Living habits. Certain medications can trigger lupus. We know that. People say stress, so it really depends on the person.
Mm-hmm. Here's an unusual question. What can I do to gain weight? Usually people go, what can I do to lose weight? What can I do to gain weight, Dr. Manzi?
Well, I would have to ask a lot of questions about that, because, so the first question is, are you eating a proper and full diet and still not gaining weight? That's number one. Are you having a lot of GI issues, a lot of diarrhea, loose stool, even more constipation? That could mean that you've got celiac or gluten sensitivity. And believe it or not, some people can't gain weight if you're eating a lot of gluten or wheat products. So I would ask about your thyroid. Do you have an undiagnosed hyperthyroid condition where you're eating and can't gain weight? So it depends on how acute is it, how quickly it happened, how long it's been there. And there's a lot of other things that your doc should be checking and asking.
Dr. Suzanne Manzi, it's been a marathon and you finished strong. You crossed the finish line like Bolt. Or you staying bold. I want to thank you so much on behalf of the Lupus Foundation of Jamaica. Thank you on behalf of the myriads, the many lupus warriors watching who have had their questions answered. It's really great to have someone of your caliber take the time to do this for us. It means a lot. We don't take it for granted, and we are truly grateful. We wish you all the very best with all your endeavors. May you continue to be, phenomenal in all that you do, and continue to be so warm, kind, and gracious as you have been to us this evening. Thank you. Thank you.
You are so, and you have been such a delightful partner, Dr. McGee. I can't wait to meet you in person.
Thank you. You can't
be really nice. And thank you, all of you. I would love it. And thank you for all of you for spending your evening with me. It was so nice. And the invitation for sure.
Thank you so much. Thank you. Thank you,
Be well,
Dr.
everyone.
Thank you.
Bye.
Thank you, Dr. Manzi. So we're coming to the end of Ask the Expert Live, and truly it was a session where there, you know, if you didn't have your specific question, and so if you didn't have a question, I'm sure you heard something that you go, oh, it's so good to know that, so good to have that someone asked that question. So as always, our aim is to empower you through education, and this was certainly full of information. It was really a great educational experience, not just for patients, but for us as clinicians as well. And as you know, Lupus Foundation, we are always geared at, always focused on education. Just to remind you that in line with that, you know, every month there's a support group. So we just had our Western support group meeting. So coming up on Thursday is the support group coming out of Kingston for those, you know, who are mainly on that side. So a meeting will be this Thursday, October 20th, this Thursday, the 20th of October. And of course, this is Zoom, so there's no barrier. Everyone will be there. We just want to invite you to join Labs for Lupus. So please go to the Lupus Foundation of Jamaica.org and see how you can participate. Labs for Lupus is coming up. That's next weekend. And by doing Labs for Lupus, you can help fundraise. Remember, Lupus Foundation of Jamaica is really dependent on, you know, fundraising efforts. So please come out. If you can't run, you can. If you can't jog, you can walk. Just come out and have fun. You can register online, enroll your friends. It's a great way to just get out and have some fun and do something meaningful. And if you're a group at work, you can sign up a whole group at work. You can sign up your whole family and just make it a day for a great cause. So thank you once again for joining us on our many platforms. Before you go, please, and just, yes, it's at Emancipation Park. That's where it will be. And so it's not, you can do virtual laps too, right? We can do virtual laps. I know last year we did many virtual laps. So this is Sunday, October 16, between 5 and 8 p.m. So no sun, you can come out and have fun, 5 and 8 p.m. All right, so that's Laps for Lupus. Remember, on Fridays, we put on purple. Purple is the color of the Lupus Warriors. So put on your purple on Fridays. Put on purple on Fridays. Pop Fridays. So let's make Fridays pop. Thank you once again for being here, and thank you for submitting your questions. And please, before you go, do like, do share, do subscribe to the pages that you've been on, because this is one of the ways in which you will get others to know about all of what Lupus Foundation of Jamaica is doing, and this can benefit those who are living with lupus or affected by lupus. Once again, it's always my pleasure to be asked to do this. I never say no, because it is so important and part of my own personal mandate, which is to be part of this education. So on behalf of all of the rheumatologists, the Lupus Foundation of Jamaica, thank you for, you know, showing your interest and participating, because this means a lot to us to get all the information out about lupus, and we'll do whatever it takes to do that. So thank you so much. Have a great evening with your family and friends. And do remember to go on lupusfoundationofjamaica.org, see all of the events and participate. And if you're shy, you know, there's something that you can do that doesn't involve, you know, being out and about. You can just, you know, go to Lupus Foundation of Jamaica's learning center. There are leaflets. Just leave some somewhere. Someone will read them and get some information. So there's something for everyone. You don't have to be the outgoing type. Some of my patients tell me I'm not the outgoing type. I'm not so much the outgoing type. So I understand, but there's a role for everyone. Blessings, take care. Thank you so much. Walk good. Thank you. And also, I'm being reminded you can set up a display at your school or workplace. So you don't even have to do the talking. Just set up something, and you know, you can make sure you redirect them to the Lupus Foundation of Jamaica. You can go to the Learning Center and get posters, pamphlets, and let them do the talking. All right. Have a good evening. Take care. Walk good. Keep safe.